Perfect. So hopefully everyone can hear me okay. Sorry about that small delay. We're just having a few technical issues. But yeah, we're just going to go and get straight into it now in terms of going through situational judgment. It's just going to be a really nice run through in terms of what to expect of a situational judgment, what are you being tested on, and then we'll be going through a few questions as well. So we'll just wait about 30 seconds longer just to admit everyone in, and then we'll get started straight. Again, if you've got any questions at all, please feel free to drop us a message on the Instagram page. We have a little kind of story there where you can just drop any messages, and we'll be going through that throughout the entire day. So please just feel free to drop us a message on there, and I'll be looking at that, and we'll be checking any questions that you have. Perfect. So let's get started. So what even is the situational judgment in the first place? So the whole idea of the situational judgment is that it's measuring your capacity. It's measuring whether you are competent enough to deal with difficult situations and really understand whether your behavior is appropriate in a certain scenario or situation. To be honest, out of all the sections of the UCAT, the SJT is the one which is most closely representative of what you're going to be doing as a doctor or what it's like being a medical student. So actually, it's, in my opinion, it's one of probably the most important one. But at the same time, in terms of scoring wise, it's probably not as important. So that's something to bear in mind. But also at the same time, the situational judgment is so important because if you score band 4, the majority of all medical schools will not allow you to even kind of progress to the next stage. So it plays a really big role in that sense. And it's also testing your kind of empathy skills, your integrity, whether you are able to kind of deal with situations, and again, at the same time, it is quite nice because it is multiple choice. So you don't need to enter anything yourself. It is multiple choice and usually out of 4 answers. So again, like I said, any questions, just feel free to drop us a message on the Instagram story page, and we'll be going through all the questions that you have. So again, just to go through the SJT, so it's actually used when you are going for your post as a foundation doctor. So you sit an SJT exam, which counts to 50% of your entire application. So it's such a huge exam that you're going to sit in the future in around 5 years' time. 5-6 years time. So it's the reason why they included it in the UCAT is just to give you a flavor of what SJT is like, what it's all about. And the questions are all about appropriateness or importance. And that's something that I'm going to go through today. There's a few kind of learning objectives from today. It's understanding what does appropriateness, what does importance mean? And then also I'll be going through really important aspects of patient safety and what you should really be focusing on in your revision as well for the SJT. So why is it even used? Well, it's used because it's really assessing what you would do in real life and seeing what response you'd make. It's also it's going to be very common when you go to medical school. You're going to be doing lots and lots of situational judgment exams. And it's all about ethics. It's all about making decisions. Are you making the correct decision, thinking about the ethics in certain situations? So these are the 5 key principles that you should be able to understand in detail so that you can tackle the SJT. The revision for SJT is quite minimal compared to the other sections. So as long as you can understand these 5 key components, you're very well on your way. So medical professionalism, what on earth does medical professionalism mean? Well, professionalism is all about your kind of, it links in actually with integrity. It's all about how you conduct yourself in a clinical setting. So for example, when we go on our medical placements, we're expected to dress quite smartly. We're expected to have certain mannerisms. You know, these are respectful mannerisms. These are showing that the medical profession in itself is showing that sense of kind of trust as well to the community. So professionalism is really important because even if you're a medical student, the community always mistake medical students for doctors. Doctors are sometimes mistaken for consultants. So you can see that it's really, really important when you become a medical student or a doctor that you're maintaining that professionalism so that you can maintain that trust in society. Compassion relates to empathy. So think about, in the SJT questions, are you being compassionate? Are you choosing an answer that is showing your empathy and showing that you're caring about someone? Confidentiality, huge one. This is really, really important, actually. So again, make sure that you're writing these 5 points down somewhere, because these are the 5 kind of key points of your revision. So especially confidentiality. Sometimes an answer in the SJT is really, really good, and it's a fantastic answer that you should select straight away. But actually, there might be issues with confidentiality. You might actually be breaching a patient's confidentiality. So just bear that in mind. Patient autonomy, what does that mean? Well, patient autonomy is relating to the fact that patients have the right to make their own decision. Okay, so the patient has the right to make their own decision. So this relates to not forcing anything upon a patient. Okay, you should never force anything upon a patient. You can advise a patient, but you can't force anything upon a patient. And finally, we have integrity. So integrity, what does that mean? I'll just give you a few seconds. Have a think, maybe just speak out aloud. What do you think integrity means? So I think integrity means really about backing up your ideas, backing up the decisions that you make, and actually being open and honest. That's my best definition of integrity. So I'll just repeat that again. It's about being open and honest and actually backing the decisions that you're making. That's how I would summarize integrity. So perfect, fantastic, right, Joe? The quality of being honest, yeah, absolutely. So SJT, let's go through the kind of just the small details in terms of the timing. So normally you have around 26 minutes. You have about 69 questions to answer, and there are 22 scenarios. So actually, I don't look at this at all. Okay, so actually I would ignore this bottom bit, time per question. You know, time per question is 23 seconds, but can someone just write in the chat, why is that kind of irrelevant? Why is this bottom point kind of irrelevant? And why should we be focusing on the scenarios? I'll just give you a few seconds. Just anyone, just have a, just type in the chat, why do you think we should be focusing on the scenarios rather than the time per question? Perfect. A really, really good point there. Lots of fantastic points, because the same scenario is used for the 4 questions. That's absolutely right. You have multiple questions per scenario. So once you've read the scenario, you understand what's going on. So actually, when you see question 1, you can answer that straight away. When you see question 2, you can answer that. Question 3, then question 4. Then you move on to the next scenario, and then you have to take a bit of time to do some reading, 30 seconds to a minute of reading time, but then you can go straight to answering the questions, kind of one after another. It literally takes 5 seconds then, because you've read the scenario. And again, anyone who's a bit confused by that, I'll just summarize that one more time. So you have 26 minutes, and then you have 22 scenarios. So each scenario, there's going to be a passage of writing there, and then you'll have 4 questions normally on that passage. So that means that roughly you have around a minute or so, more than a minute per scenario. So it's plenty of time. So time-wise, the SJT shouldn't be too bad. So that's why when you're practicing, you know, take your time, read the scenario properly, and think about those 5 points that I just mentioned before. 5 really, really important points. You know, thinking about integrity, think about confidentiality. Also think about patient safety. We need to keep the patient safe at all times. If you're doing anything that's compromising patient safety, you are you're not going to be choosing the kind of most appropriate scenario there, or most appropriate answer. So let's go through these 2 points, which are very important. So you've got type 1 questions and type 2 questions. So what does type 1 mean? Well, type 1 means that you're given a scenario, and then you've also given different responses that you would take. So is this a very appropriate thing to do? Is it appropriate but not ideal? Is it inappropriate but not awful? And a very inappropriate thing to do. So a very inappropriate thing to do is an awful thing. It's not something that you would be doing at all, because it's probably, again, think about those 5 points again. It's probably relating to professionalism. You're probably not using any form of integrity. You're probably compromising patient safety. So again, just think about those 5 points that I told you to write down before, because that's very, very important. Everything really relates to that. And if you feel like one of those points are being affected, you're more likely to be picking inappropriate but not awful, or a very inappropriate thing to do. So what about type 2 questions? So type 2 questions, you're given a scenario and then told different factors. So then you need to decide whether those factors are very important, important, of minor importance, and not important at all. Okay, so all of this will be clarified just in a bit. The reason why I put this slide here is just so that you can appreciate that there are 2 key types of questions in the SJT. And again, there is a third one, which I might touch upon a bit, but it's quite simple, really. You're just ranking. Type 3 is about ranking your two scenarios out of 3. So you're given 3 possible responses to a scenario, and all you have to do is choose the most appropriate and the least appropriate. That's quite simple. It's quite easy to really understand there. So appropriateness. Let's now think about probably the most challenging part of the SJT is understanding the differences between these 4 aspects of the answers. And again, to clarify one more time, the marking for SJT, I just want to clarify this, really, really important. It isn't from 300 to 900, it's band 4 to band 1. Why is this really important? Because if you score band 4, you're basically ruining all your chances of getting into medical school. Your application will basically be scrapped. So it's really important that you're getting into these 3 bands. Some medical schools even look at your kind of whether you get into band 1 and band 2 in a bit more detail. So just bear that in mind. So appropriateness, let's go through that now. A very appropriate thing to do. So I just want you to think, I would really like someone to just put on the chat, because that would be really helpful for everyone actually. Can you think of an example of something that would be very appropriate, a very appropriate thing to do as a doctor? So just give you a few seconds, think of it mentally, maybe write it down. What's a very appropriate thing to do as a doctor? It's quite a general question, I know, but just have a think about the themes of being a doctor. Okay, so some really, really good points to begin with. Listening, very, very important. We've got things like advising the patient on the different options available to them, explaining the procedure, asking for consent, introducing yourself to a patient, making your patient feel comfortable, good communication skills. Exactly. This is what I'm trying to get at, really. These are the very appropriate things to be doing as a doctor. Gaining consent, very, very important. But again, remember, each scenario won't always kind of talk about gaining consent and things like that, because that's quite self-explanatory. So don't fall into that trap of, if they haven't mentioned gaining consent directly, take that with a pinch of salt. So I know that gaining consent is important as a doctor, but because these passages are so small, don't kind of overthink that. So a very appropriate thing to do is the optimal approach, and addresses a key issue in the scenario. So it means that at least one aspect, but not necessarily all aspects of the situation, are addressed. So what does that mean? Well, what that means is that a very appropriate thing to do, you are doing something very, very well, but you might not be sorting everything out. So yes, you might be dealing with the patient in that scenario and sorting something out, but actually maybe something is still kind of lingering with regards to the patient's family, or with the patient moving on to a different form of care. So what I'm basically trying to get at here is that a very appropriate thing to do is something that is really addressing a key issue. So bear that in mind. It's addressing something which is a key issue, but it might not necessarily be addressing everything. Okay. So can anyone think of something? Again, this is a really tricky question. So again, take your time if you're going to answer this on the chat, but it would be interesting to see what ideas people have. What's an appropriate but not ideal thing to do as a doctor? So just have a think about this. What's an appropriate but not quite ideal thing to do as a doctor? So I can start off with one actually. There are a few coming in the chat. So for example, I might be taking blood from a patient, but actually I cause them quite a lot of harm. They seem in a lot of pain, and maybe I haven't taken the tourniquet off. So the tourniquet is basically a band that you put around the arm, and it's there to just basically make the vein pop out a bit more. So sometimes if you leave that tourniquet on, that can cause a bit of distress, and actually the patient can bleed quite a lot. So, you know, I'm taking blood. Yes, I am. I did take the blood. But at the same time, I did cause a bit of harm. So, you know, it's something has happened, but again, it's had a bit of a disadvantage. Something hasn't gone exactly to plan. So I'll just have a look at the chat now. So bringing an issue with a co-worker up to a supervisor before the co-worker themselves. Fantastic. I'll just repeat that one more time if anyone hasn't read that. Bringing an issue with a co-worker up to a superior before the co-worker themselves. So what that point is saying is, before just going up to the most senior person in your team, why don't you talk to that person who you're having trouble with and actually talk to them and identify what the problem is to begin with. Have your assistant nurse ask for consent from a patient. Yep, that's a nice point. And provide personal opinions on difficult situations. So yeah, that's a nice point as well. So sometimes your personal beliefs can sometimes get in the way of the actual problem here at hand. We all have different beliefs. We all have different opinions on certain matters. But again, when you are in the medical profession, you need to think about what is the most appropriate thing for this patient. What am I doing things for the patient's best interest? So again, appropriate but not ideal. I think everyone's got the gist of this now. So it's not an optimal approach, but there are no significant negative consequences. So although it can be done, it doesn't necessarily mean it is a very good thing to do. Okay, so I'll just repeat that one more time. It's not an optimal approach, but there are no kind of significant negative consequences from that. So when I mean significant negative consequences, I mean that patient safety, or for example, patient's confidentiality isn't being affected. Those, again, think back to those 5 key issues from before, that they aren't being affected in a lot of detail. So inappropriate but not awful. I'll just go through this just briefly. So it shouldn't be done, but if it did occur, it would not be a terrible scenario. So one of the things that I like to think about here is that we're now thinking about issues relating to even death. We're thinking about issues relating to compromising patient safety. You're not quite doing that. You're not causing patient death. You're not causing something that is absolutely horrific, but it really isn't fantastic, and it's going to lead to something which isn't quite perfect. And I think a very inappropriate thing to do is quite self-explanatory. It's going against our key ethical principles, and it's compromising patient safety. Okay, very, very simple. A good way to think about very inappropriate thing to do is it is going against our key ethical principles, and it's compromising patient safety. So again, it's a poor approach. It has potentially very negative consequences for patients, but also, again, a really nice point here about public confidence in the profession. So again, this is things like bickering behind a patient's back, saying something about a patient's family member when they're not there, but then someone else overhears that. Okay, and again, it could lead to very serious consequences, and it can make situations a lot worse. So let's go through my favorite part, which is actually going through some questions so you can understand what we're talking about here. So perfect. So Ashir, I just want to check something. Have you got the poll ready? Perfect. So have a read of this question and then try and have a go at the answer. I'll give you about a minute or so. brilliant. So that's been 1 minute. We've had about, well, it was near 80–90% of everyone voted there, which is fantastic. Let's go through this question. So I'll just read it. So a junior doctor is on an acute surgery ward. Sorry, a junior doctor on an acute surgery ward completes their work efficiently within the hours they are contracted to work. They have a lot of spare time and they do not find the work very challenging. How appropriate are the following? So we've got that they ask the consultant doctor if they can spend the spare time that they have to help other junior doctors who are in wards that are a bit busier than theirs or are busier than theirs. So what do we do? How do we tackle this question to begin with? Well, one of the first things, and again, this is a really important point from today to bear in mind, is always look at the person involved in the situation. And I say that because every single time students make silly mistakes on questions like this, it's because they haven't understood what they are in the situation. So in this situation, you're a junior doctor. You might be a medical student. You might be a dentist. You might be a consultant. Your position makes a really big difference in different scenarios and situations. So just bear that in mind. Have a read of who you actually are. So it seems that you have worked very efficiently. You've worked within your hours, and now you have a lot of spare time. So you're asking the consultant if they can spend. So again, what's really nice is that they're actually asking, and they're asking whether it would be appropriate for them to help other junior doctors who are busier than theirs. So actually, this seems like a very kind of appropriate thing to do in this situation. I'm trying to think of any disadvantages. So if you, every time you think about selecting A, have a think in your head, are there any kind of significant disadvantages to this problem or this scenario? So I'm trying to think of some. Maybe a disadvantage is that this junior doctor might be getting in the way of other doctors. I can't really think of anything else. I think it seems like a very good idea, because if other doctors are struggling on certain wards, they can actually help them out. They can actually, that will actually lead to better patient safety. That will lead to better patient patient outcome. So actually the answer to this question was A. Absolutely, it's a very appropriate thing to do. And I'd highly recommend, if doctors are, they've got through all their work and they've got a lot of free time, they can go and kind of help other doctors. So again, some people are raising some really good points here about can't junior doctors end up burning out, for example, in situations like this? Well, that's a really good point. But actually, I think it's the fact that the junior doctor themselves has actually realized that they're basically not finding the work very challenging. They're just kind of, they've got a lot of spare time. So actually they're being quite proactive in this situation. So that they feel like they want to help out. Again, if they were struggling, if they were finding the work very challenging, that's slightly different. So it's a fantastic point that I think Faisal has made there. And it's, again, really good about kind of thinking about that. But the reason why I disagree with you is simply because of the fact that they haven't found the work very challenging. They want to kind of push themselves in that respect. So let's move on to the next question. Perfect. So the poll should be coming up just in a bit. We'll just try and get it sorted. Perfect. There we go. Again, just remember, this is a slightly different scenario in this situation. So I'm just going to read it out one more time. So this is a bit different to the SJT itself, because you would have the scenario, you'd have one specific scenario and then 4 questions. But for this, I'm just doing a different scenario each time just to get a bit more practice in. So I'll read it out to anyone who hasn't kind of read it properly. So a medical student is currently supporting the team on the ward round. She is struggling with the workload and her exams are coming up, which are causing her to become stressed. How appropriate are the following responses? So they tell the consultant that they're withdrawing from several cases effective immediately. I think there was a bit of a typo there, sorry. So they tell the consultant that they're withdrawing from several cases effective immediately. Okay, so let's have a think about this. Yes or no in the chat, does the fact that they're a medical student make a difference in this situation? Yeah, fantastic. So yes, it does. Can someone tell me why? Why does it make a difference? So why does it make a difference that they are a medical student? Why does it make a difference that they're a medical student? Really good points that we've got. So they're not qualified, they're still learning, they don't have as much experience, and they don't have responsibility over patients directly. Fantastic. That really summarizes it, to be honest. I'll just repeat that one more time. They're still learning, they are not qualified, they may make mistakes, and also they don't have true responsibility over the patients. And again, the priority in as a medical student is actually to ensure that they are focusing on their exams, they're focusing on their studies as well. So that's really, really important. So they're currently supporting the team on the ward round, which seems fantastic. They're struggling with the workload and they have exams coming up which are causing them stress. So think, put yourself in the shoe of being a medical student. So I'm struggling with the workload. I have exams coming up next week. What do you think I should do in this situation? Well, what I would do is probably speak to someone. I don't know who, maybe a doctor, maybe the consultant, maybe the senior person there, and just explain to them that I have some exams coming up. I am really struggling. Would it be okay if I can perhaps go and maybe take some time off at 11 o'clock and actually leave and kind of go home and do the revision, and because I am finding things quite stressful. So that's how I would go about this situation. Now let's have a look at the answer here. So they tell the consultant that they're withdrawing from several cases effective immediately. So this is a really nice question where we're thinking about how you're going about approaching the situation in the scenario. How are you talking to the consultant? How are you talking to other people? And I think everyone has realized that actually, yes, absolutely fair enough. As a medical student, you have to prioritize yourself and your studies and your learning and the exams coming up. But at the same time, you can do that in a nice way. You can do that in an appropriate way. So what I would say is that, in kind of the scenario that I was picturing, a very appropriate thing to do would be to tell the consultant that actually they are struggling with the workload, they have exams coming up. Would it be okay if they leave soon or leave after kind of seeing one more patient? That would be a very appropriate thing to do. So what I would say in this situation is that this is probably it is kind of appropriate, because they are tackling the issue here at hand. The issue here is that they have a big workload and they have exams coming up. Are they tackling this situation and problem? Yes, they are. But it's not ideal, because they're just telling the consultant that they're just kind of leaving immediately. So the consultant might be a bit confused about why they're just suddenly leaving. They haven't given an explanation as to why they're leaving as well. So that's why I would say that this is B. Some people, I think quite a lot of people chose C, and I can see why. But the reason why I think I would have chosen B is because you're actually tackling the problem here. And the problem here is that they have a high workload and that they have exams coming up. If this medical student does go immediately, actually it wouldn't make too much of a difference for the team itself and patient safety and patient care. Yes, medical students are kind of important to support the team, but they're there actually to learn. They're not really doing things directly to kind of improve patient care, if that makes sense. So well done for anyone who kind of did choose C, and they're kind of thinking about some of the disadvantages of this scenario. But that's why I wanted to really emphasize the point that because they're a medical student, this case is slightly different, and you would 100% be choosing B for this situation. Okay, Brilliant. So we've gone through kind of 2 scenarios. Hopefully that's kind of starting to make you think about how you approach these situations. I think, what do you think so far? Can someone put in the chat, what are some key points that you have to bear in mind in these SJT questions? What have you learned so far? So what have you learned so far? What are some important things to bear in mind when you're approaching these questions? What are some kind of the key kind of tips that we've gone through so far? Yeah, so first of all, think about whether you're addressing the problem. Who are you in the question? Really, really important. Who are you? And just make sure that you're addressing the problem to begin with. And also think of the negatives that can happen in the scenario as well. Are there going to be negative consequences or significant negative consequences? Perfect. So a quick question that I have just has just come through on our Instagram is, how many marks do you need to get band 1 or band 2? Well, how long is a piece of string? I don't know. No one knows, actually. And the reason for that is because every year that mark does change, and it changes quite dramatically, and it's all depending on how hard the question is, how hard the scenario is. And actually this relates to what medical school is like and what exams that doctors take are like. Doctors and medical students generally take exams that are sometimes different from one another, so they have different questions. So to make it fair, a big panel of senior members of the team will be going through each question and identifying whether this question is very, very challenging or very, very easy. And that's why the marks are never equate to a direct kind of band 1 or band 2. What I would recommend going through in terms of a rough guide is that 66%, so basically 2 out of 3 questions that you get right, should be putting you in the kind of band 1 to band 2. Okay, that's kind of a rough estimate. And again, just to clarify, SJT is graded from band 4 all the way to band 1. So band 1 is the best, band 4 being the worst. And if you do get band 4, a lot of these medical schools don't actually accept you at all into the medical school. Perfect. Next question. I'll give you 1 minute for this question. Just a few more seconds. Fantastic. So let's go through this question. Quite a big spread, actually, in terms of answers. So let's see where people are kind of struggling. Let's see how we approach this question. So the question is, a junior doctor who developed a fear of needles is asked to carry out a lumbar puncture. So does anyone actually know what a lumbar puncture is? Just drop it in the chat. What is a lumbar puncture, and what's it generally used for? There's a certain condition that if patients have, you are thinking about actually going for a lumbar puncture. Yeah, so fantastic. It is about taking spinal fluid. And fantastic, meningitis. So when patients, again, I'm just going a bit off on a topic, but it's really important actually. So when patients have meningitis, this is inflammation of the meninges. So it's an outer layer of the brain. Now, when you have an infection, you want to actually take some of the spinal fluid and actually identify, are there bacteria in this spinal fluid? Very, very important. Now, again, let's think of an even harder question. When would you not do a lumbar puncture on a patient with meningitis? So when would you not do When would you not take a lumbar puncture from a patient with meningitis? So there's a patient with meningitis. One of your doctors has said, okay, we want to do a lumbar puncture, and you say, actually, no, I'm not going to do that for a particular reason. So some good answers here about thinking about maybe they're elderly, they're fragile, when they don't consent or have capacity, risk of further infection. So really good points. But actually, the point that I was thinking of, and actually it's a really important point. When a patient has increased intracranial pressure, so what I mean by that is if fluid is starting to build in the brain, that means that the brain is basically kind of expanding in the skull. So there's lots of pressure building up in the brain. Now, if you take a lumbar puncture, you're actually reducing the pressure at that spinal part of the spine. So what's actually happening is what happens with pressure. Pressure goes from high pressure to low pressure when it can. You know, things with high solutes will always go to low solutes. So things go from high pressure to low pressure. So if you've got a lot of pressure in your brain and suddenly you stick a needle into the spine, all that high pressure is going to go down to low pressure. So what actually happens is something called coning. So what coning means is that the brain can actually be pulled down into the spinal cord, and that is obviously extremely dangerous. So again, I've gone off on a bit of a topic, but it's something that for everyone to really be aware of is that a lumbar puncture is contraindicated. So contraindicated means not used when a patient has increased pressure in their brain, so really increased pressure. And again, if anyone interested, just have a look at what coning means. It's when the brain is basically pulled down into the spine because from the high pressure to low pressure. So let's go through this question. A junior doctor who developed a fear of needles is asked to carry out a lumbar puncture. Luckily for them, they have chosen a future medical specialty which does not require them to use needles. So the question, they tell the consultant that they will only do the procedure if they accompany them. So quite a mixed bag here with regards to answers and what people chose. What I would say for a question like this is you're a junior doctor, you don't have too much experience with needles. However, you should actually be competent. You should have maybe practiced this before. You should really have a level of competency to carry out something like this. So luckily for them, they have chosen a future medical specialty which does not require them to use needles. Is that really significant in a question like this? Perhaps not, because you're a junior doctor at this moment in time, and you need to perform this lumbar puncture. So you tell the consultant that they will only do the procedure if they accompany them. Right. So one of the first things I'm thinking about all the time is patient safety, patient safety. So do you think the patient is going to be safe in a situation like this? So I just want you to drop a message in the chat. Do you think the patient is going to be safe in a situation like this, and why? Maybe explain a bit about why. So why do you think they won't be safe? So again, this is where it gets a bit tricky, because some people think that yes, it is safe if a consultant is there, but they might still be scared, and they might still, if they've got a fear of needles. Imagine if a doctor has a fear of needles and a patient has a fear of needles, you're not really going to go in the right direction here. It's going to be really, really challenging. So, and the fear of needles could lead to them making a mistake. Yes, the consultant is there kind of observing and watching, but actually at the end of the day, it's the junior doctors who is going to be performing this. So that can lead to some sort of kind of patient safety issue. So lots of people have put some really good points in the chat about the fact that if they're scared, they won't be performing the procedure properly. Even though a consultant is there, yes, the consultant might be accompanying them, but it's the fact that the patient is the doctor is actually scared of needles and actually scared of this in the first place, which is fantastic. Really, really good points that people have made there. So we've identified something quite important there, haven't we, about the fact that patient safety is probably going to be affected quite a lot. Another thing that I've really thought about with this question is that they tell the consultant that they will only do the procedure if they accompany them. Are you saying this in the right way? That's debatable. Okay, so the reason why I say debatable is because it's probably not the most important thing I'm thinking about in this scenario. But what I can say is that they're being potentially a bit aggressive and a bit kind of, I'm only doing this if you join. Okay, I'm only doing this if you accompany me. Does it relate a bit to professionalism? Potentially. Okay, so just bear that in mind. So we considered all these things here. Now, what are we going to decide to go for? Well, one thing I can say is that it's definitely definitely not going to be A. It's definitely not going to be B because of the kind of patient safety issue. Now we have to think about inappropriate but not awful and a very inappropriate thing to do. So can someone please tell me, why do you think it's probably not D? So can someone say in the chat, why do you think it's probably not D? So why is it probably not going to be D? Yeah, it's the fact that the consultant is there, I think. Yeah. So it's the fact that they are kind of still opening up to the consultant and talking to the consultant about this. So that's the reason why I think it's not going to be D, because actually they have said to the consultant, they have actually spoken to the consultant, and also the consultant may potentially be accompanying them. So that's why for this, the answer to this is C. And can everyone see about how I've logically gone about thinking about the answer to this question? The way that I did this is I went through it quite methodically, and I thought about patient safety. I thought about those 5 other key points that I mentioned earlier about integrity. Again, I'll just very, very quickly go back to that in case anyone has missed it. Right at the beginning. There we are. So again, we're thinking about professionalism. We're thinking about compassion. Again, compassion, even relating to doctor-doctor compassion. You know, yes, compassion is important for a doctor-patient relationship, but also compassion is important between doctors and other doctors. Confidentiality, patient autonomy, and integrity. So those were those 5 key points. And also something that embodies all those 5 points is patient safety. Okay, so this is the next question. Have a go at this. I'll give you 1 minute to answer the question. Hopefully, if I just get the poll set up, there we go. So what I want you to think about for this question is actually, why have you actually chosen this answer? Think about what are the factors that you're taking into consideration to choosing this answer. So yeah, it's all good and well choosing an answer, but in your mind, you have to think of some reasons about why you're choosing it. That's what being a medical student and being a doctor is all about. Yes, you've made a decision, but why have you made that decision? Okay, and again, this is really good practice also for your interviews later on down the line. So let's go through this question. So again, a few people asked me a bit about coning and meningitis. Again, it's really, really interesting actually. So definitely have a quick look at that later on. It's all about the pressure moving from high pressure to low pressure. And basically, if you're sticking a needle in, you're decompressing pressure. You're basically lowering pressure at that spinal level. So all that pressure from the brain is basically going to go down, and the brain is actually going to be squashed down the hole into the spinal cord. You are a medical student speaking to a 67-year-old lady called Halima, who's waiting for her results from her recent chemotherapy. She's extremely nervous and anxious about what the results may be. Okay, so you're a medical student, you're speaking to a 67-year-old lady. She's waiting for some sort of results about her recent chemotherapy. She seems very nervous and anxious. Okay, I've got a bit of a picture in my mind. So a medical student telling a patient that they think it was a medical student telling a patient that they think it was a success, when in fact they know that it is likely that the treatment has not actually worked. So I think basically everyone chose D for this question. And I just want to really clarify why this is D. The reason why this is D is this is relating to lots of different issues here. And again, I think the majority of people have actually put it in the chat. You're giving false hope. You're not being honest. So you're lying. You're basically lying. And also you are, and why is that bad? So why is lying bad? Why is giving false hope bad? Well, actually, this is linking with trust in the healthcare profession. If this patient is already feeling anxious and feeling, really, really nervous about getting the results, and then you tell them that actually, things are going to be fine and everything's going to work out, then actually they get told that things didn't go too well, they are basically going to lose trust in the system. They're going to lose trust with the doctors. And also finally, like a few people have said, they're going to confuse the patient. And this is going to be a horrible experience for the patient. So a few people, just to kind of clarify this, what can you define a very inappropriate thing to do? Of course I can. So a very inappropriate thing to do is something that compromises patient safety and also is linking with key ethical issues that are being compromised. So you're going against the key themes of being a medical student and being a doctor, and that is generally linking in with patient safety, but also it's linking in with the well-being of people. So when I mean people, I mean the well-being of patients, but also think about doctors as well. So if you're significantly affecting one of your peers or one of the nurses, the doctors in some way, that is a very inappropriate thing to do as well. So Faisal has made a really good point here about if a patient is nervous, then calm them down, but don't give them false information. That's absolutely right. So you can calm them down. You can let them know that just to maybe think about all the good things that are happening in their life at the moment. Ask them about what they've been up to. Just try and calm them down. Think about maybe giving them some breathing exercises, and you can do some breathing exercises with them. Basically, just being a nice person. Be a nice person in this situation. Anita has said, is it ever appropriate to lie? That's a really good question. Is it ever appropriate to lie? How about a white lie to someone? Good question. I think in general, I think it is never appropriate to lie, really. I think the whole medical profession in itself is really about trust and honesty and being open. So if you're ever thinking about lying, you really have to start you need to start really thinking about why that is. Maybe with I'm even talking about little kids. If you're giving a little kid a vaccine and they're really, really scared, even then, I wouldn't directly be lying to them, but I would be saying things in a slightly simpler way. So, this is something that is just going to protect them from getting bugs in the future. It's only going to last a second. It might not last a second. It might last 2, 3, 5 seconds. Okay, so that's why I think lying is something that it is try and get it out of your mind. And if you are thinking about lying to a patient, think about why you're actually considering lying and how can you change your approach. Again, with people with dementia, again, we're really going into kind of a lot of depth with this, which is fantastic because this is about how you should be thinking for the SJT. So Anita also mentioned about if you're with patients with dementia, can you lie to them? And again, this is all very situational dependent, isn't it? So it's all about the situation, the time. If a dementia patient is being very, very anxious and not really cooperating, sometimes you might need to skew things. You might need to change the way that you talk to actually change their perspective slightly. So it's all very situational dependent. Nat has said, again, I'll answer this question now. So what about if a family member asks about test results, but the patient told you not to tell them that they've come yet? Fantastic. So no, you wouldn't lie. You wouldn't lie at all. But what you would say is that as a doctor, as a healthcare profession, I'm obliged to actually maintain patient confidentiality in this situation. So actually, I can't actually tell you about this, about whether the test results have come back or not, because this is actually that would be breaching patient confidentiality. So I really hope that helps, Nat. And also a few people were wondering what the answer to that question was as well. So I'll just clarify that one more time. So if a family member asks about a test result, but the patient told you not to tell them, you don't have to lie. You never have to lie in this situation. You just have to say that actually this is a patient confidentiality issue, and I'm not actually obliged to tell you whether results have come back. I actually need to speak to the patient, and if the patient says that it's fine for me to tell you, then I can do that. But actually, it's all relating to patient confidentiality. So again, you don't need to lie at all. You need to be honest. You need to be open and clear about why you're making that decision. Brilliant. So there is one more question. I'm actually trying to get it up, but I'm struggling. Let me get the question. There is one question that has come up. Okay, fantastic. So someone on the Instagram said that, are you meant to know about medical terminology in the exam? Really, really good question. Not really. You're not meant to know lots and lots of medical terminology. But what I would 100% say is, please try and understand the key ethical principles. So make sure you understand what autonomy is, what beneficence is, what justice is. So just very, very briefly, I'll mention it. So we've gone through autonomy already, haven't we? So autonomy is the patient has the right to make a decision. What does beneficence mean? Can anyone say, can anyone try and answer, what does beneficence mean? Exactly. Fantastic. So it's all about best interests. So Miss Arb, it's not quite do no harm. That's actually linking with non-maleficence. So you're actually thinking about a different ethical principle there, which is non-maleficence. So beneficence is doing something for the patient's best interest. A lovely way to remember that is beneficence starts with kind of BEN, and I like to remember it as something that's beneficial for the patient or something that is going to benefit the patient. Okay, and again, will relate to best interest. So I'll just put that in the chat just in case anyone's getting confused with that. So that's best interest and benefit the patient. Okay, that's a really nice way to think about beneficence if you're confused. And then non-maleficence basically means do no harm. So obviously you shouldn't be harming any patients, but sometimes we do need to cause. When do we sometimes cause harm to patients? Okay, so that's the next question. When do we sometimes cause harm to patients? When this balance between beneficence and non-maleficence. So yeah, the one that I was thinking of is fantastic from Nat. It's all about kind of chemotherapy, and also actually, this is a really important point. Every single medicine that we ever give a patient will have some sort of side effect, won't it? Okay, so actually medicine in general is always about balancing up beneficence and non-maleficence. Even if I give a patient some medication that is used every day, I don't know, paracetamol, aspirin, these are drugs that are used by many patients across the world. However, there are still lots of side effects from this medication, and actually we have to think about weighing up, are the risks more or less than the benefits? So that's a really important part of medicine in general, and they might even kind of have a question similar to that in the SJT about kind of weighing things up. Is the risk worse than the benefits? I think there's one more question I'm just going to answer from the Instagram, and that is, are you allowed to change subject if are you allowed to change the subject if family members are crying or are concerned? So I'm not too sure what that quite means, but what I would say is that if a patient is upset and is crying, you need to just comfort them and try and deal with the issue right then and there. Yes, they might be crying for a particular reason, but actually we just need to make them feel comfortable. Fantastic. So I just want to kind of summarize briefly, what have we discussed today? So can someone please, to be honest, everyone, if they can, just write in the chat, can you just summarize what have been the big kind of learning objectives from today? What have we actually got out from today? What's been the point of today? So just have a think, what has been the point of today? So we've gone through a few things. And I'll just give you some time, just do a bit of self-reflection. What have we got out from today? What was the whole point of it? Yeah, so a few things. So we've referred to the key ethical principles, haven't we? And those ethical principles are really important for the SJT. I think probably, in my opinion, the most important one to think about all the time is patient safety. You can think about patient safety, you're well on your way to doing well in the SJT. Another important point to think about is who are you? Who are you in the situation? And I think another big point that we've gone through today is going through understanding what is the difference between a very appropriate thing to do and not a very appropriate thing to do. Again, lots of fantastic answers here in terms of balancing factors for making judgments and judgment questions, and always look at the person involved and the consequences of the actions. That's really fantastic. Always look at the person involved and the consequences of their action. And again, remember about those 5 things that I mentioned earlier. So all I can really say there is thank you very much for joining. I really hope that this was useful. Please, if you can you just drop a quick kind of review on Trustpilot or on Google at MedicMind, just to kind of give me some feedback, and just kind of say if you did actually enjoy it and you found it useful, please can you do that? We're just going to drop a quick link in the chat. Please, it literally is a minute of your time. I've given up my hour, so hopefully you can give up kind of just a couple minutes just to fill something in. I think I really do appreciate everyone who did join today. I do understand that it is the weekend. Thank you very much for joining, and if you can just drop us a quick thing on Trustpilot or on Google, just say if you enjoyed today, what you actually got out from today, and basically I can do more of these sessions in the future if you found it useful. So we've just put it on the chat. Just have a quick look. Thank you so much for everyone who joined today. Hopefully you found it useful. If you've got any other questions, just drop us a message on the Instagram, and I can just answer it for you, really. And I can get back to you if you've got any particular questions about specifics. But yeah, hopefully everyone found this really useful. Thank you so much for joining. Please just drop a quick message on Trustpilot. Just give a quick review. It is really helpful, because that way we can I can do more of these sessions. And yeah, hopefully I'll see everyone very soon.